Hello, everyone. Thank you for joining us today. My name is Juan Espinosa, Director of Student Success here at the UCLA School of Nursing. We are very excited today to have our last Faculty Spotlight lecture of the year, and we are ending on a high note with Dr. Anita Bralock. For go around some introductions. Dr. Anita Bralock stands as a paragon of dedication and compassion in the field of nursing, with a career deeply rooted in advancing women's health and nursing education. Her journey began at Highland Park Community College in Detroit, Michigan, where she earned her associate degree in nursing. She later expanded her academic horizons, obtaining a Bachelor of Science in Health Sciences from Chapman University in Orange, California. A double Bruin, Dr. Bralock continued her educational pursuits at UCLA, earning both a master's degree in nursing as a clinical nurse specialist and a PhD in nursing. Complementing her extensive academic background, she completed a certified nurse midwifery program at Charles Drew University of Medicine and Science. Maintaining her national certification through active involvement in clinical practice as an adjunct associate professor, Dr. Bralock has been shaping the next generation of nurses since 1991. Her teaching portfolio at UCLA spans maternity, public health, women's health, and immersion courses for both undergraduate and graduate students. Formerly serving as the UCLA SON Pre-Licensed Nursing Program Director for 5 years, she played a pivotal role in advancing the program's success and facilitating student achievements. Thank you. Let me just admit this new couple folks here. Cool, and let me share the screen. Here. Awesome, wonderful. Here, admit. There you go. Oh, and let me give here. I'll make you co-host, Lisbeth, so that you can admit people as they come.
Sure.
Thank you. All righty. Take it away, Dr. Bralock.
Okay, well, thank you very much for joining me, everyone, and I hope that you can see me okay. I'm just going to bring the laptop closer so that I can advance my slides. So thank you so much, Juan, for that great introduction. And I'm not sure if you all can see that I have some props on the desk. This is not going to be your traditional type of presentation. I'm hoping that it's a lot of fun, but I brought props as well as I have a lot of pictures in my slides. So just to give you a little introduction.
Some water.
Oh, thank you. I'll be going over my long career as a nurse, and I've been a nurse since around 1980, 1981. I'm originally from Detroit, Michigan, and I'm very, very proud of being from Detroit. And I'll share some pictures with you about, Detroit. But as Juan mentioned, that's where my education started with me becoming a nurse. So this is a picture of me showing that I am a true Bruin. I have been a part of UCLA's long history. This cup says 70 years. And so when you think about this cup that says UCLA School of Nursing 70 years, I've been a part of that 70 years.
Amazing.
I'm a double Bruin.
So cool.
Yeah. But as you can see from the slide, I started my training in an associate's degree program. So I'm an associate degree grad that now has a PhD. And so that took a lot of hard work and many, many years, but I finally did it. And then I don't have the traditional BSN. I have a Bachelor's of Science in Health Sciences from Chapman University. When I got my bachelor's in health sciences, that was around the time that a lot of ADN nurses were actually getting a bachelor's in something other than nursing. And they were using those bachelor's degrees to work various jobs in nursing. But that didn't work very long because those jobs that didn't have a bachelor's in nursing, they didn't exist for very long. And that's when I decided that I needed to go back to school and get my master's degree. And I came over here to UCLA to get a master's degree without a bachelor's in nursing.
Wow.
But I did have a bachelor's in another field. So it's sort of like the MECN program that we have right now, where you'll get your master's even though you have to have a bachelor's in any area. So it's sort of like the Meccan program is today. And then as well as my PhD in nursing in 2023, and my master's was from 1991. And I'm also a certified nurse midwife, and I attended a nurse midwifery program that was basically a certificate program because I already had a master's degree when I sought my midwifery certification. I'll talk a little bit more about nurse midwifery training in case anyone might be interested in that. So when I think about my teaching experience, I have to share this with you. I know you can see this, right? What does that say? It says USC. And I know it's funny to be on the UCLA campus. Of course, everybody, realizes that USC, this is our big rival, but it's a plaque that I received from USC that says Dr. Bralock, most inspirational.
Oh,
And I started teaching there in 1991, and I stayed there until the program actually closed down. You all probably don't remember, but that was in 2004. They closed the nursing program, that traditional nursing program. And I actually taught with Dr. BBJ. So those of you that know BBJ, we came together from USC and we got our experience at USC and then transferred over here to UCLA. And then another thing I wanted to share was the lamp. We know that this is the tradition, the lamp of nursing, and we light that torch like Florence Nightingale did all those, decades and hundreds of years ago. And then lastly, this is the picture when I graduated with my associate's degree from Highland Park College. And that's when we wore caps. Can you all see the cap that I'm wearing? And so I see a thumbs up. Dawn, she can relate to that. So we wore caps back in those days. And so I'm really, really proud of that. So my teaching portfolio, you can imagine, since I've been teaching since 1991, I can basically teach anything. But when I got the job at USC to start teaching, I only had a master's at that point. I didn't have my doctorate. And I was a labor and delivery nurse, and I had a master's degree from UCLA as a clinical nurse specialist in maternal child health. So I was hired by USC to teach maternity. So I was hired to teach maternity, and I basically started teaching maternity in both the lecture and the clinical. So I got my experience teaching there and taught there for 13 years, like I said, until they closed the program. But I also have experience teaching public health. I have a certificate as a public health nurse. I have experience teaching women's health. I've taught advanced practice nurses. Most of them are family nurse practitioner students. And when they take the antepartum course, I am an expert in women's health. And that's when I teach advanced practice nurses. And of course, I've taught nurse midwifery at the same school where I did my midwifery training at Charles R. Drew University. That's where I also taught nurse midwifery there for a period of time. I've taught fundamentals. I think every nursing faculty member has taught fundamentals. That's the course that typically most people start out on. And then this quarter, I'm actually teaching an immersion course, which here at UCLA, our pre-licensed students take immersion as their last quarter prior to graduating. And I have 5 students that are in an immersion course over at UCLA Ronald Reagan. I have to go over there and visit with them. 3 of them are on labor and delivery, and 2 of them are on the postpartum units. And so I guide them in developing a QI project as they're completing 360 hours over this next 10 weeks and as they graduate in 2024.
wow.
And then finally, I've been on PhD and DNP dissertation committee members. I haven't ever chaired a committee because I'm a non-Senate faculty, but I participated starting with my job at Azusa Pacific. I have been a part of PhD committees. So this is just a few pictures of some of the students I've taught. That picture on the left where I have my hands up, that's the Meccan students who are actually graduating this year. They're graduating in June. And I taught them fundamentals, and I taught them, most recently, I taught them maternity nursing. I believe that that was our last lecture when we took this picture. The picture down at the bottom, that was just this past winter quarter when I was teaching public health clinical down on Skid Row. And so that's Skid Row, if any of you are familiar with being down there. And these are my public health students. And then the picture up at the top, we were at the one of the missions that they have downtown for the unhoused, and we took that group picture. And so I've had a lot of experiences, most recently with public health, but I really like that rotation, and the students do, get a lot out of it. So this is another picture that we took. I don't know how many of you have heard of Homeboy Incorporated, but Homeboy Incorporated is an agency. It's the largest agency in the United States that works with people who have been former gang members, and they help them with getting out of that lifestyle. And so we were down at Homeboy for our public health rotation just a couple of weeks ago. So this is a very, very recent picture. These are public health nursing bachelor students who are going to be graduating in June. So now I can talk a little bit about my leadership roles. I have had quite a few leadership roles. I started out teaching at USC, like I mentioned, as a faculty member. But then I went on, when they closed that program in 2004, I had just gotten my doctorate, my PhD in 2003, and I knew that I could pretty much write my own ticket at that point. And so I was like, well, where am I going to work? And I took a position at Azusa Pacific University. Now, I don't know how many of you are familiar with Azusa APU, but Azusa was very different from USC. I was coming from USC, which is a private university, but it's secular. And then when I went to Azusa Pacific, it's a Christian university, and you have to sign a statement of faith. However, I went in as an assistant professor, and from 2004 until I left in 2010, I did obtain tenure and became an associate professor after getting my dissertation published. And my first administrative position was at Azusa. I became a department chair of the pre-licensed programs, and that's where I learned how to be an administrator and learn how to work with faculty and learn how to organize clinical groups and get BRN approvals and all of those things. Then I also received an appointment at Charles R. Drew University right around the time I was leaving Azusa, where for a short period of time, I was the program director of their certified nurse midwifery program. However, unfortunately, they closed that nurse midwifery program and it transitioned over to UC Irvine. And then my biggest position as an administrator was at a small university. I'm not sure if you've ever heard of it, but it's American University of Health Sciences. Oh, wow. It's in Signal Hill in the Long Beach area. And I was actually the dean for the School of Nursing for 5.5 years. Wow. And during that time, I was instrumental in securing national and regional nursing accreditations. They received their CCNE accreditation, the very initial CCNE accreditation, when I was the dean from 2010 until 2016. And when I left there in 2016, I came over to UCLA as an adjunct associate professor, which is the position that I'm in now. But I also was a program director of the pre-licensed programs here at UCLA. I did that for 5.5 years. And if you really think about it, American University was a small school that had about 250 pre-licensed students that I was the dean. And here at UCLA, my title was Director of Pre-Licensed Programs, but it was basically the same number of students, about between 250 and 300. So it felt almost like a deanship, but here at UCLA, our dean is Dr. Dean Zahn, and I was considered one of the program directors. After 5.5 years of doing that, through COVID, it was very, very stressful, all while being the director of DEI. And so I stepped down as the program director June 30th of just this past 2023. Right now it's Emma Cuenca, who used to be my assistant director, and now she is the director, but I still strongly support her because I know how challenging that job is to be the pre-licensed program director, because we have the MECN program, okay, and we have the bachelor's program. And so we are responsible for all of those students once they start taking their clinical courses here. So this is a picture of me as the Dean of Nursing at American University of Health Sciences. That's the picture on the left. I'm in the middle, and the person on the right, Dr. Joyce Newman Geiger, who actually is a professor emeritus from here at UCLA and an endowed chair. She actually became the president at AUHS before retiring. And then the person on the left, Dr. Cheryl Pagem, that was before she got her doctorate, but she became my assistant dean. And then the picture on the right is actually someone from the pharmacy school was sitting behind me, and that's the provost sitting to my right. And he took that picture from behind. My hair looks blonde. It's really not that bright. I don't know why my hair came out looking so blonde, but he was sitting behind us, and we're on the stage facing the graduates. And he took that picture of me, and that's our graduating class at American University of Health Sciences when I was the dean. So I thought that was a really cool picture to add. So we can talk a little bit about my research contributions. My research is mainly focused on public health. And because I'm a certified nurse midwife, mainly working in an ambulatory setting, I saw that there were a lot of my adolescent patients, a lot of my patients that were a lot younger, that would come in for family planning GYN, and they were not practicing safer sex. They were not using condoms. They were being diagnosed with chlamydia, gonorrhea. I was treating them for a lot of sexually transmitted infections. And so I became interested in why they were getting the STIs, why they were not practicing safer sex. And a lot of you will find that your research questions will come from your clinical settings. And so I was able to create a research study that I obtained my sample from my clinical practice. It was adolescent females ages 14 to 21. And I did a mixed method study where I actually did actual interviews and I had them complete questionnaires. And I was looking at a lot of gender empowered issues and self-efficacy, trying to determine if the young women even felt empowered to get their partners to use condoms. And actually, a lot of the young women had partners who were significantly older than them. So even though the girls were ages 14 to 21, there were some that identified partners as old as 42 years old. And so many of them did not feel empowered, and that had a lot to do with why they were not using condoms consistent. They just didn't know how to get their partners to cooperate or participate. So we really need to think about those gender empowered issues, and we need to educate our teens that they need to use condoms with every sexual encounter. Other research that I've done, especially when I was at AUHS, we at American University of Health Sciences, we did a publication on homeless communities, and I've also highlighted a lot of my work in publications, as well as, of course, those of you that are in DNP or PhD studies programs will have your dissertations published. Around the time when I was working on finishing my PhD, that's the time when you really go out and you get to participate and present your research at a lot of different places. So for example, I went to Panama to a conference and I presented my research. I went to Brazil and my research was translated to Portuguese.
Wow.
And I presented my research there. And I traveled to Australia and I presented my research in Australia as well. So I love traveling. I'll share a few pictures later. But when you are finishing your doctorates, this is your opportunity to make sure that you publish your dissertation in peer-reviewed journals and get disseminate that knowledge, which is what people want to know. What research did you do and what were your findings? And they want to hear all about it. So now I can talk a little bit about my community service. So when I was working at American University of Health Sciences, we had owners of the university. They were not nurses or doctors. They were entrepreneurs and they owned the university. And it was small and it was private and it was private for profit. So, I mean, I was coming from USC, which was private, but, a nonprofit, right? And then I went to Azusa Pacific, which is private, but a Christian college where you had to sign a statement of faith.
Right.
And then I went to American University, and I did not realize at the time what I was getting myself into, to be honest, because it was private and it was for profit. And so, it was quite different from anything I had experienced before. And the owners, it's a husband and wife. And the wife is Vietnamese. And so we used to plan a lot of trips to do medical missions trips. For example, the wife had a connection with a physician who is a pediatrician. She's originally from Vietnam, and her husband is an anesthesiologist. And they have been planning missions trips to Vietnam for years. And she's a pediatrician, he's the anesthesiologist. And we actually, I'll come back, but I'll show you a picture where we actually went to Vietnam in 2014. And you can see that this trip, we went with a team of 100 health professionals, that this husband and wife, the pediatrician and anesthesiologist, he even took some cardiologists with him were a part of our team. And those cardiologists were training physicians in Vietnam to insert pacemakers. I took a group of 10 nursing students who were in our nursing program, and we went to Vietnam and were a part of this medical mission trip. We spent about 7 days there, 5 days of working like 12-hour days providing care. We probably provided care on average to like 400 and 500 people a day. So we had a real impact. I wanted to just share this with you all also. I don't know if you could see this, but this is a piece of art. You can tell can you tell where this is from, Juan?
Oh, I can't tell where it's from, but
it's from Cambodia.
Oh,
and
okay.
so Cambodia, of course, is very close. And so we also had a trip to Cambodia.
Wow.
And that was because of our connections with our owner, who, as I mentioned, is Vietnamese and had a lot of connections in that community. We had one faculty member from Jamaica. And so one group of students went with her to Jamaica, and we did a medical missions trip there as well. So I really like that part of community service. And if anyone is interested in going on trips, or maybe I think I'm going to go to Vietnam in 2025.
Yes.
Yeah.
Nice.
And so if any of you are
So cool.
interested in going on any medical missions trips and you want those connections, please reach out to me. Other parts of my community service include providing healthcare expertise to underserved communities. And that can be done if you all are interested. That can always be done through different clubs. That could be done through different churches. But I am one of the original co-founders of Panza. I don't know if you knew that, Juan.
I didn't know.
But we
Wow, that's
started
amazing.
Panza. It was back then it was called the Black Student Nurses Association. We changed the name later to Pan-African. But we started that back in 1991 when I was in my master's program. And a lot of us, as African American, there were small numbers of us in the APRN program. And we just honestly didn't feel like we were getting a lot of the support that we needed from the faculty. So some of you may know the name Rhonda Flanoy Younger, but she was a part of student services back then. And we had a faculty named Dr. Cheryl Killian, and we organized this group so that we could support each other. And Panda exists to this day. We also have Lanza.
Yeah,
And we have Apienza. And so we have quite a few organizations, but I've been here long enough that I'm one of the co-founders of Panza, which started back in 1991.
Nice. That's very impressive.
Thank you. And finally, I'm the chair of a governing board at a small community hospital. I don't know if you've ever heard of East LA Doctors Hospital, but I actually worked there as a labor and delivery nurse back around early 1990s. And then I was approached by someone to see if I'd be interested in being on their governing board.
Wow.
And they were surprised to see that I had actually been a L&D nurse back there, there back in the early 90s. So I joined the governing board. If you're familiar with governing boards work with like the medical team and the doctors when they need to have credentials approved and need to have policies and procedures done and different things like that. And so I joined that board back in 2015, 2016, and I became the chair of the governing board just this past December.
Nice.
And so I'm the only female on the governing board, and I'm the chair and the only African American as well. But because of my long history as an L&D nurse there, I felt very honored to be a part of East LA and to give back to East LA Doctors Hospital, which is right in the heart of East LA, and that's an underserved community. And so that's another way for you to give back. So this is a picture of anybody on this call a part of the APRN program. Do you know who that is in the lower right corner? Do you know who that is with me in the picture on the right?
That's Dr. Hamilton.
That's Dr. Hamilton. When she had shorter hair, her hair is very, very long now. So I think I came here in 2016. So that picture might have been taken, I don't know, maybe around 2017, 2018. And then on the left, that's me, that's myself and Dr. Sherika Miller. Dr. Sherika Miller is interesting. She's a graduate from our PhD program here at UCLA. And she has actually done a documentary and written a book, and it's from foster care to PhD.
Wow.
So she actually was in foster care for a lot of her life, her and her siblings, because her parents were either incarcerated or had drug issues. And so she tells her story through a documentary. She's a prolific speaker, and she was actually the commencement speaker for her cohort when she graduated from here at UCLA. So her and her wife, that's their daughter. And you see we're representing Panza, but that was at the UCLA commencement, the year that Dr. Sherika Miller graduated. So I'm thinking that might have been around 2019. I think that was right before COVID.
Okay.
Yeah, right before COVID. And so we're representing UCLA at graduation. And you see, I'm wearing my cords as well from Sigma Theta Tau. You can see that I have the cords around my neck. Yeah, you can see that.
Nice.
All right. So this is another part of the world. Okay, this is all the way, you know where that is? Doha, Qatar. So I actually went there with my daughter. I was interviewing for a job as a certified nurse midwife around 2015. At that point, I had been the dean at AUHS for about 5 years, and I was already burning out. And I had seen this opportunity to work international. And, we hear these stories about going to Saudi Arabia or going to these countries where they pay you like $1 million because they have so much money. They're just throwing away money. You see my money you see my picture of my money.
Yeah.
But my daughter at the time was actually living in Mumbai, and she met me in Doha. And I went and I interviewed, and I didn't end up taking the job. It was a brand new hospital that they were building, and it was just taking long for them to finish building the hospital.
Wow.
And so, but I did go to that country, and you can imagine it's very different from being here. It's very, very hot. Most of the time, people are not there in the summer. They go to Europe or they go to other places because the temperatures in the summer can reach like 110, 120, and it's not someplace that you would want to live all year long. But I did actually go and interview there. So if any of you are interested in international jobs, you generally you get a contract with an organization. You don't stay there. You might stay there for a year or two, but it could be an exciting opportunity to
Yeah.
have an international job.
And you get to travel.
And you get to travel, because I'm telling you, you wouldn't want to be there in the summer. That's when you'd be traveling to probably Europe. That would be some of the closest places. Now, here is when I went to Cuba in 2016. And I love convertibles. And so that's me and that taking the, I wasn't
I love
driving.
that. It
I
looks
was,
so
yeah, I
good.
wasn't driving.
It was just- was it
Yeah,
for the
yeah,
photo?
it was just for the photo. Don't let it fool you. I'm
It
not
looks great.
driving.
It looks really good.
But I went to Cuba in 2016, and in 2016, you have to like go with a group of people. We went, like, our visa was as educators. We went to Cuba. I don't know, is it easier to go to Cuba now? Have you heard that it's a little
I
bit
wouldn't
easier?
know. I wouldn't
Right.
know. But yes, as far as I know, sometimes you require special visa to go.
You have, right,
Yeah.
right. And so we were able, we actually went on a cruise.
Oh,
It
wow.
was a cruise ship.
Oh, nice.
Yeah, I think we flew into Jamaica, and we cruised from Jamaica or something like that. So we didn't fly into Cuba. We actually were on a cruise ship.
Oh.
So that was a very nice trip. And they have you can imagine the health disparities and the
Mhm.
healthcare issues. There are a lot of people, that had some real serious illnesses. So what about my clinical practice? Well, I do have a clinical practice. I'm actually actively still working as a certified nurse midwife, but in an ambulatory setting. And you can see from this picture that nurse midwives in the US have been around for many years. And midwives used to travel by horseback in the South. I don't know if you all even knew that.
Wow.
And a lot of those, so that's like rural South, where midwives travel by horseback, and they would go to more remote areas to see their patients. And I always tell people that the picture on the right, those are my ancestors. Those are African-American nurses, or probably lay midwives that would come to the homes and would deliver the babies. And when I tell people that I'm a nurse midwife, they assume that I'm delivering in the homes, but I'm not delivering in the homes. I'm, working more in an ambulatory setting. So what is a certified nurse midwife? Well, certified nurse midwives treat patients in 3 settings. Ambulatory, which is where I'm currently working. We take care of the patients in the clinics who are pregnant or need family planning and contraception. We also work in intrapartum settings where we take care of patients in labor and delivery. Like when I mentioned my immersion students that are doing labor and delivery rotations, they're actually over at UCLA Ronald Reagan. However, they don't use midwives at the Ronald Reagan location. They're only, my students are working with interns and residents, but UCLA Santa Monica, which is up the street, that's where they have certified nurse midwives seeing the low risk patients. Most of the patients at Ronald Reagan have a lot of complications, and they're very, very high risk. And so they're not managed by midwives. But we also take care of patients after delivery in what we call the postpartum period. And that's when patients will come and see me in the clinic for their 6-week postpartum checkup, or some patients call it 40-day checkup. So the educational requirements: you must be a registered nurse to go to midwifery school, must have completed at least a bachelor's degree, and your training of the certified nurse midwives begins at the master's level and the DNP level. As to get into these programs, it's usually highly recommended that you have experience as a labor and delivery nurse. You need to know medication administration. You must know fetal heart monitoring, and understand that midwifery programs, they basically use the medical model. So what you'll learn in the nurse midwifery program the three components are antepartum, which is what I practice. UCLA allows faculty to work outside of their full-time teaching positions, but you must sign a document that shows you're not ever working more than 48 days in a year.
Oh, wow.
So that basically comes out to be about 1 day a week.
Okay.
What are there, 52
Yeah,
weeks?
maybe
Yeah.
one, maybe 2 days.
Yeah, about 1 day a
1 day a
week,
week.
40, no more than 48
Oh.
days. And I never get to 48 days. But if I am working, it's generally on a Saturday. And I'll cover at this one clinic that's near Western and Santa Monica in the Hollywood area. So 99% of my patients are Spanish speaking, and they really benefit from, they use certified nurse midwives, and I'm the only certified nurse midwife in the clinic. They have nurse practitioners, and they can also use PAs. But we provide the antepartum care, and in these nurse midwifery programs, you learn to care for pregnant patients in clinics or ambulatory settings, and you provide care during the entire pregnancy. But in my clinic, we transfer the patients to the physician that's going to do the delivery at about 36 weeks gestation. So I'll do the initial prenatal visit, and then I'll see the patient all the way through the pregnancy. And then when they're ready to deliver, then I transfer them over to the MD who's going to be going to the hospital to do the actual delivery, since I don't do any deliveries. Another thing that you learn in midwifery education programs is family planning, GYN. Now, at the clinic where I'm working, I've done thousands of pap smears, but right now I do mainly pap smears with my pregnant patients, because we're not seeing family planning GYN patients right now. But I've prescribed thousands of, forms of birth control, from, of course, oral contraceptives, birth control pills, insertions of an IUD, prescriptions like providing Depo-Provera. So everything that you see on these slides, I've done as a part of the family planning and GYN training that you receive in midwifery training. So we learn to care for patients who are not pregnant but need contraception, GYN care as patients become older and are menopausal, and treatment for sexually transmitted infections, which is what I mentioned to you earlier about the young women that were coming in that were being diagnosed with STIs. And so we learn to write prescriptions, and we can receive a DEA number. That's mainly for people working in ambulatory settings where they'll be prescribing narcotics. It's really expensive to have a DEA number. I don't know, it costs $1,000 or something.
Wow.
Everything is expensive. I have a colleague who is debating whether she's going to renew her license, because I just renewed my license February 29th. So I have my RN license. I have a license as a nurse midwife in California, and I have my furnishing license. All three of those licenses have to be renewed at the same time.
Wow.
It cost me $500. And every 2 years, I need to pay another $500 to renew my license. And so a DEA number, just to say I have a DEA number, if I'm not going to be using it, why pay $1,000 every couple of years? And I'm not in a setting where I'm prescribing narcotics. But it just goes to show you that I do have those abilities. And then finally, here's your intrapartum and postpartum. And so if I were one of the people that I went to midwifery school with, I graduated from nurse midwifery school in 1995. She and I went to midwifery school together, and she actually is working at UCLA Santa Monica. She's one of the certified nurse midwives working in Santa Monica, and we graduated from midwifery school together in 1995. So that would be an ideal job. I never had an opportunity to get one of those jobs, as we call full scope. And so I ended up working in the ambulatory setting, and I stayed in an ambulatory setting. But your midwifery training, you learn to deliver pregnant patients in hospital settings, and you learn to take care of the patients after the delivery during the postpartum period. So you would discharge the patients home. And here are just some alternate ways to deliver the baby. Although you all are, I'm sure, are very familiar with this. We have birthing centers, we have home births, and then water births. I've never done a water birth. All of my training when I was in nurse midwifery school, I learned how to deliver at the old Martin Luther King Hospital. And then I did my, most of my rotations for learning to deliver were at Kaiser Permanente in Woodland Hills. And so I was working with interns and residents and other midwives, but I never delivered I have never done a home birth, I've never done a water birth, and I've never delivered at a birthing center. So I just want to end up by talking about mentoring and advocacy. A lot of the people on this call are nurses. Maybe you are going back to school to get more education, or maybe you're working as a nurse. But I just want to reinforce how important it is for us to be mentors for the nurses that are coming up behind us. And so my current role as a co-investigator. Juan, I know you've heard about the Summer Health Professions
Yes.
Education Program, SHPEP, here at UCLA. I've been a part of that since about 2017, 2018. I'll share a few pictures with it. We have a longitudinal mentoring program here at UCLA, and we have a cohort that's going to be starting the SHPEP program class of 2024, and they're going to start mid-June. And we're always looking for mentors for the SHPEP program. So if anyone's interested in being a mentor, the program is 6 weeks, and you basically would have telephone calls with them every once a week while they're here at UCLA for the 6-week program. And then when they go home, you could have a conversation with them at least once a quarter or once a semester to keep up with them. They're generally going to be freshmen and sophomore, and they haven't started nursing yet. They're trying to get into nursing programs. So we're always looking for mentors. And so keep in mind the importance of being a mentor in advocacy. And I'm dedicated to guiding college students through their nursing school journey. I've mentored hundreds of nursing students, and I'm actually working with 2 of our nursing faculty were my students at USC. One of them is one of my clinical instructors in maternity. She's a nurse at Cedars. She graduated from USC, and she was one of my students. And the other one is one of our critical care med-surg faculty, Barbara Rojas. Do you know her, Juan?
Barbara Rojas.
Yeah, she teaches in the Meccan and Bachelor's program, and she was one of my students at USC as well.
Wow.
And so now I'm colleagues with the people that were my students when I started teaching in 1991.
That must be very meaningful.
It is very meaningful.
That's so awesome.
It feels very good. And finally, embodying core values of nursing with compassion, integrity, and advocacy is what I try to instill. So then these are just some pictures. The picture on the left is the SHPEP program, the ones that are the pre-nursing. There are 20 of them, and that's the cohort from 2023, just last year.
Oh, wow.
This was the day that they came in and they met Dr. Dean Zahn, and she shook every one of their hands. And I'm telling you, they were so excited to personally meet the dean from the UCLA School of Nursing and to shake her hand. And so it was very meaningful to them. There are 80 people all together in the SHPEP cohort. 40 of them are pre-med, 20 are pre-dental, and 20 are pre-nursing. So cool. And the picture at the bottom, that's the whole SHPEP cohort of 2018. That's the dental, the medicine, and the nursing all together.
Wow. How many people was that?
And that's 80.
Oh, wow.
And then the picture up at the top, here at UCLA, we have a lot of summer programs. One I know you're familiar with. During the summer, they always have high school students come to UCLA, and they'll stay here on campus. And I do a lot of speaking at a lot of those events. Like this is one that I did just the last summer. Can you see me on the front row trying to take a selfie?
Oh, yeah.
That's me. And so there were physicians And the front row, those are doctors. And I'm the only nurse in the group. I'm usually always the only nurse in the group. But those are all high school students that were here on UCLA campus, learning about medicine and nursing and learning about the health professions. And so I'm always a part of their speaking groups and sessions that they have throughout the summer. So this is different from SHPEP. SHPEP, I'm actually one of the co-PIs. This is basically, those are physicians, and we just talk to these students and we're trying to encourage them to be doctors and nurses when they graduate. And we're giving them guidance on how to get into nursing and medical school. So what is my future? Well, probably retirement is my future, but retirement from teaching in 2025, I'm thinking, but I'll continue to practice in an ambulatory setting as a certified nurse midwife. And I actually am thinking about opening up a business. I want to open up a doula service.
Oh, what is that?
So a doula is someone that will stay with patients when they're in the hospital. And doulas provide support to patients. They're not nurses, but they can be someone that can be with the patient to provide them support as they're laboring. They can also go to the homes and they can help people that need breastfeeding assistance, or they need understanding about breastfeeding or how to take care of the baby when they get home. So they have doulas, and they just started in January of 2023. We can get Medi-Cal reimbursement for being doulas.
Oh, wow.
And so this is a picture where I actually finished doula training just last month well, now it's been 2 months, it's May 1st, right? But March of 2024, and that's Dr. Virgie Waters. She finished our PhD program. She's actually a triple Bruin.
Oh, wow.
She got her bachelor's degree here. She was one of the original Panza members.
Aw.
She got her bachelor's from here. She got her master's from here, and she just graduated with her PhD in 2023. And she defended her dissertation at the end of around Thanksgiving. And so her and I finished this doula training, and we're thinking of opening up a business where we're going to train other doulas, as well as have a doula service where we can train people to be doulas and then hire them as a part of our doula service.
Wow.
And so that's a part of my future, as well as traveling. So when I'm not nursing, it says, when not nursing, what does she like? Sports, and more sports.
Nice.
All caps. I also like stargazing, traveling. I like movies and driving my 1988 BMW.
Oh,
So the picture on the left, you can't see, would have to be dark, but that was just taken at Joshua Tree during a new moon in March. New moon means no moon. And so then that's a beautiful sunset at Joshua Tree. I was actually there with a friend of our family who is the park ranger, and he took me on a private tour of Joshua Tree. And so that was just a month or so ago. And then these are pictures of me with my sporting regalia on, starting at the top left. That's a Raiders game. And then you see me at the top, I'm at a tennis match. And then on the green shirt, I'm at a Yankee game. That was just summer of 2023. All of those, I think, are 2023. And then with the hat, I'm at Derby Day. So I like the races. With the horses. And there I am on the right at the top at a Rams game. I'm you see my big Rams necklace that I have on. Down at the bottom, I'm at a Laker game at the Staples Center. That picture with the Clipper jersey on, that was actually my 60th birthday.
oh, wow.
For my 60th birthday, I went to a Clipper game and I was sitting like mid-court. That's what I call a birthday celebration. Right?
Yeah.
And then the last two pictures down at the bottom were just taken a few days ago. I don't know how many of you are football fans or knew about the NFL draft that they had over the weekend, but that's me. And you can't see all the people, but there were 275,000
Wow.
people in downtown Detroit last Thursday at the NFL draft. And that's a picture on the right of the stage where it shows the NFL commissioner at the podium, where he's about to announce the first round draft pick. So that was just a few days ago. And then this is a picture of me with my Rams jersey on, representing my home team, of which I'm a season ticket holder. I go to all the Rams games that are at home, and then I also travel and I go see the Rams when they're on the road. I've attended 2 Super Bowls. Super Bowl when the Rams lost in Atlanta to the New England Patriots. That's that picture on the far left. That's Super Bowl 53. And then I was fortunate enough to go to the Super Bowl in LA, Super Bowl 56 in LA, when my home team, the Rams, won.
Oh,
And then the picture on the right is the Super Bowl that was just in February of this year. That's the one that was in Las Vegas, Super Bowl 57. I have a friend who's coordinating the Super Bowl that's going to be in 2026 in the San Francisco's new stadium. And I'll be attending that Super Bowl in 2026. So I will have attended a total of 3 Super Bowls. So you could tell I'm a
nice.
real sports fan. Finally, that's a picture of my 1988 BMW that I like to drive. And that's a picture of me at the movies to see Deadpool. I said I like the movies.
Nice.
So I just want to end showing a family portrait. I know my family that's on this call is probably surprised to see that picture. But that picture, you see, we all have masks on. So do you know what year that was, Juan?
2020?
That's 2020.
2020, right?
That's 2020. That's 2020. Black Lives Matter. We had a Black Lives Matter event
Nice.
at our home, and that's
Wow.
the immediate family. And the dog, that's our pit bull named Tupac.
Oh,
And so this is a family picture that we took to show our, support of George Floyd and the Black Lives Matter movement. That's my daughter with the red scarf, and her wife, Stephanie, kneeled down. That's me and my husband, Cleveland, and that's my son, Jonathan, and his wife, Marisol. She was pregnant with twins, and she delivered her twins in 2020, and now they're almost 4 years old.
wow.
So I just want to say that nursing has given me so many great opportunities. I've loved every minute of it, and I wouldn't have done anything other than be a nurse.
Wow.
So thank you so much.
Thank you, Dr. Bralock. That was amazing. And we do have a couple minutes. If there are any questions in the Zoom room, go ahead and unmute yourself and just let us know your questions or comments. Any questions from the Zoom room?
There's a question in the chat.
Oh, there's a question in the chat. Let me see.
Oh, okay.
Stop sharing. There we go.
I should see a comment
Yeah, there's a couple.
from Elizabeth Cahoot.
Elizabeth Cahoot says, this is so random, but I was at the Ronald Reagan ED with a friend last week, and it came up that I'm a student at UCLA. It turned out my friend's nurse, who was wonderful, had Dr. Bralock as a teacher at USC. She said it was a lecture class, so there's no way Dr. Bralock will remember her, but she wanted me to pass along that she loved the class with you. I promised her, I said to that Jennifer from the class of 1998.
Wow.
Yeah.
Isn't that from USC? Yep.
Mhm.
Go Trojans.
Yay.
Better not say that too loud, right? Anyone else?
Any other questions or comments?
Well, I just want to thank everyone. I know there's a lot going on campus today, with everything, with the demonstrations and everything, but you all stay safe. And I just want to thank everybody for coming. I want to thank my family, my colleague, Gwen Jones. I hope she's here. And Dr. Atienza, who is one of my colleagues. We work together here at UCLA. We teach together. And I just want to thank everybody for supporting me. And I'm happy that I could end us off with the
Yes.
final faculty spotlight.
Absolutely. Thank you so much. This was great. We're very happy to have you. Very honored to hear about your journey and success. And
Yes.
Stick around for, once the faculty spotlight program returns in the fall.
Right.
Thank you so much,
Okay.
everyone. Have a good
Okay.
one.
Thank you.
Thank you, Dr. Bralock.
Thank you. Thank
Bye.
you. Thank you.
Yay. So let's end this here.